Living with a painful past feels like an unfair sentence. So, in this video, we're going to dive into the less talked about signs of trauma that really hurt and how to start healing from them. We'll cover 5 strategies, with number 1 being super effective overall, so hang in there till the end. Now, let's jump right in. Trauma happens when you go through something super stressful or upsetting, and emotional trauma really messes with your feeling of safety. It can leave you feeling totally helpless and scared of the world. Dealing with this kind of trauma means battling strong emotions, recurring memories, and ongoing anxiety that just won't quit. It can also make you feel numb, disconnected, and like you can't trust anyone. Lots of things can cause this kind of trauma. It might be a one-off event, like an accident or a violent attack, especially if it blindsided you or happened when you were young. Or it could be from going through the same awful stuff over and over, like bullying, domestic violence, or being neglected as a kid. Other times the causes are more hidden and easily missed, like losing someone suddenly, enduring verbal abuse, harassment, parents splitting up, or facing a deeply hurtful experience, and especially if it was intentionally cruel. These hidden causes are always around, even if we don't immediately recognize them as sources of trauma. Understanding and dealing with these things is key to healing and moving forward. If you've been through any of these experiences, the next step is recognizing the emotional and physical signs of trauma. Interestingly, just because someone goes through a highly stressful or traumatic event, or even multiple traumatic events, doesn't necessarily mean they'll develop a trauma disorder. On the flip side, that same person could develop a trauma disorder from an experience that seems much less severe compared to what they faced before. So spotting these signs is the real deal. Signs of trauma. There are 2 main categories of signs and symptoms of trauma: emotional and physical. Emotionally, reactions to trauma can happen during or after the traumatic event. They can vary a lot from person to person and are influenced by things like cultural background. Some emotional responses to trauma include denial, where the affected person refuses to accept the situation, like not accepting the death of someone close. Another emotional response is depression. Studies in mental health have shown that experiencing trauma during childhood can increase the risk of developing emotional trauma. So if you're dealing with depression, there could be a connection it's worth looking into. Other common emotional responses include mood swings, anxiety, feeling sad, feeling unsafe, and having difficulty trusting others. These emotions can be signs that trauma is affecting you, and recognizing them is the first step toward healing. Sometimes people experience symptoms that seem like physical illnesses, but are actually linked to trauma. These symptoms can be both physical and behavioral. They might include chest pain, nightmares, trouble sleeping, feeling tired all the time, substance abuse, difficulties at work or school, eating disorders, reckless behavior, and more. It's important to note that these symptoms can vary widely from person to person, and their severity can also differ. However, what's consistent across all cases is the treatment approach. You can start healing those emotional wounds that have been lingering by exploring some coping options, which we're now going to delve into. Number 5. Face the trauma. Dealing with trauma is tough, and it might be tempting to just ignore it and try to move on, especially if the emotional pain stems from something that happened in the past, like childhood abuse. But the first step toward feeling better is to admit that you've been through emotional trauma and that your feelings are valid. Pretending it never happened won't help you in the long run. Also, recognize that emotional abuse can create lasting trauma. It's valid and just as serious as physical or sexual abuse. Be kind to yourself and show self-compassion. Remind yourself that what you went through was really tough, and it's okay to feel whatever emotions come up. It's normal to feel a mix of intense feelings about your trauma: sadness, anger, shame, guilt, fear, and more. Allow yourself to feel it, all without judging yourself. Remember, this isn't easy, but you're taking steps toward healing. Number 4, practice self-care. Healing always begins with self-care. It's not just about reducing stress, it's about feeling good too. During your healing process, make self-care a regular part of your routine by doing things that bring you joy and show yourself some love. Simple self-care practices can make a big difference and don't have to cost a thing, such as going for a walk. The key is to carve out time for yourself and prioritize activities that make you feel valued and cared for. Remember, practicing self-care doesn't mean you're selfish as it's essential for your well being. So aim to exercise regularly, eat nutritious meals, and get enough sleep. These steps can significantly improve both your mental and physical health. Number 3, trauma focused therapy. Getting help from a therapist can be a game changer when you're healing from emotional trauma. Therapists who specialize in trauma care are key to recovery. They create a safe space for you to talk about what you've been through and work through it. There are a few types of therapy that are especially helpful for trauma survivors. One is cognitive behavioral therapy, or CBT, which helps you change your thinking and develop healthier behaviors. It shows you how your thoughts, feelings, and actions are all connected. Another type is trauma-focused cognitive behavioral therapy, designed for kids and teens who've been through childhood trauma. In this therapy, you'll talk to a therapist who understands trauma. You'll learn coping skills, emotional regulation, and new ways to see your experiences. In the case of a kid or teen, the caregivers can also learn how to support you better through this process. There's another type of therapy called prolonged exposure that helps survivors of emotional abuse face things that remind them of their trauma. In PE, you gradually confront these triggers in a safe and supportive setting. This exposure can be done by imagining the trauma and talking about it in detail during therapy sessions. The goal is to retrain your brain so you feel safer in these situations instead of avoiding them out of fear. PE empowers survivors to confront their memories and regain a sense of control in their lives. Lastly, there's eye movement desensitization and reprocessing therapy, or EMDR. This therapy aims to reduce the intensity and emotional charge of traumatic memories stored in your brain. It involves back and forth eye movement or other types of bilateral stimulation to process distressing memories. Over time, this helps you become less reactive when you think about the traumatic memories of your emotional abuse, making them feel less overwhelming. Number 2, practice mindfulness. One thing that really helps with healing is mindfulness. It's about tuning into each moment and being aware of what's going on around you and inside you. For trauma survivors, overwhelming emotions can be a big challenge. Mindfulness can teach you to notice your thoughts and feelings without getting swept away by them. When you practice mindfulness, you pay attention to everything, your thoughts, feelings, and even how your body feels. This can be super helpful for reducing stress. Studies show that mindfulness helps people take charge of their minds better, so they can stop anxious or upsetting thoughts in their tracks. By tuning in to what's happening in your mind, you can catch negative thoughts before they take over. Meditation and breathing exercises, which are part of mindfulness, can also help lower stress and make you feel more calm and settled. Number 1, support groups. Having a supportive social circle is super important when you're recovering from emotional trauma. Your friends and family can create a nurturing environment that helps you rebuild trust in others and give you the emotional support you need. Being around supportive people makes you feel safe and more comfortable as you navigate life after trauma. They can help you process what you've been through and teach you new ways to handle its effects. It's a journey that takes time and effort, but many survivors will tell you that reaching out for help and being open to healing is totally worth it. Over time, you can start to feel like yourself again and build strong, healing relationships. You might even discover new hope and purpose in life. Talking to supportive friends, family, or partners can be really comforting in some cases, as it feels good to share your experiences without fear of judgment. Moreover, when you're surrounded by positivity and understanding, it motivates you to keep going. Eventually, you'll find the strength to overcome obstacles and move toward a brighter future. So reaching out for social support is a crucial step in healing from trauma, and you likely won't regret taking it. After a disaster or a traumatic event, it's normal to feel anxious, numb, confused, guilty, or despairing. Usually, these feelings start to ease up after a while, but if your reaction is really intense and sticking around, making it hard to do everyday things, it might be time to reach out to a mental health professional. You can also try some of these tips to cope with the signs of emotional trauma. That wraps up today's video. If you found anything helpful in this video, don't forget to subscribe, because improving your mental health means a better life overall.